Mealtime is more than a bowl of food. It's the foundation for a long and healthy life. At Wellness, dry recipes are crafted with the highest quality natural ingredients for a taste that pets love, and scientifically proven through AFCO feeding trials to ensure that every complete and balanced meal supports the 5 signs of well-being. With Wellness Pet Foods, pet parents can share a life of well-being together with their pet.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Thank you so much for taking time to be with us here today.
Thanks for having me.
All right, let's dive right in. So, Jennifer, your JAVMA article discusses how measurement of antibiotic use in cats and dogs presenting to U.S. primary care and referral practices provides insights for antimicrobial stewardship. Please share with our listeners the background on this article.
Yeah, so I think most practicing vets have experienced an increase in antimicrobial resistant or AMR bacterial infections in their patients. And we know that AMR is a global health concern in people and animals. If you were paying attention to the news back in September, there was a high-level meeting about AMR at the United Nations General Assembly. So there's a lot of attention focused on this topic. Not so much in companion animals, so that's one of the things that I have wanted to address. And there are certainly lots of different actions needed to address AMR, but the use of antimicrobials, including antibiotics, is a really important risk factor for the development of AMR. And the cool thing is it's under all of our control if we're prescribers, right? It's something that we can directly impact. And a colleague of mine who's a co-author on this study, Dr. Amanda Bedoin, always says you can't manage what you don't measure. So that was our goal, was to measure antibiotic use in cats and dogs.
I like that phrase, actually. Cool. We actually, I don't know if you know this, but we have an antimicrobial themed collection of freely accessible articles published in JAVMA and HIVR on our website. So far, that's a resource for our readers.
Yeah, AVMA has a lot of really wonderful prescribing resources.
Definitely. So what are some of the important take-home messages from this JAVMA article?
So there's a few. I think one of the big ones was that in this study, we saw a lot of use of metronidazole for the treatment of diarrhea in dogs. And we have a lot of really good evidence now that using antibiotics can further disrupt intestinal microbiome. And we know the microbiome has all these wonderful positive impacts on the whole body. So there's sort of hidden effects of using an antibiotic in that situation that I don't think we always think about when we're prescribing for diarrhea. There's also a handful of studies that show that even though it makes us feel better, using antibiotics in that situation doesn't actually resolve diarrhea faster. So I think one of the outcomes for me from this study is that this is an important area that we need to focus not only education for veterinarians, but really importantly, client education. Clients are really, used to receiving an antibiotic when their dog has diarrhea. They don't have a lot of tolerance for diarrhea, but I don't think they know all that we've learned about this disease and how antibiotics affect it, not always for the better. So that's one thing. The other thing that we saw a lot of was the use of third-generation cephalosporins, so things like cefavecin and cefpodoxime, I think most people know as like Convenia and Simplicef, in situations when other first-line agents that carry a lower risk of the development of AMR could have been used. And I think we see this most frequently in cats. And cats are also prescribed more fluoroquinolones than dogs, so things like pradofloxacin and rofloxacin, marbofloxacin, and those drugs also carry a bigger risk for AMR. So I think that's maybe another takeaway. And lastly, we just didn't see a whole lot of use of bacterial culture and susceptibility. We know this is true. It's expensive. There are a lot of barriers to it. But there are other diagnostics that are more accessible and less expensive, like cytology. And in our study, like only a third of the situations in which antibiotics were prescribed to treat infection were actually confirmed infection, and 11% there was actually no evidence of infection. So I think that kind of gets to sometimes we're prescribing antibiotics and we don't really know what's going on because we want to do something. But this is an area I think that we really need to focus a lot on in vet med, this sort of like fear-based prescribing or just in case prescribing, especially as we learn about the impacts of antibiotic use when we don't need to be using it.
Yeah, Jennifer, you might know I'm a equine specialist. So for us, it's the same, but it's trimethoprim sulfamethoxazone. Like every scratch, every cough, everything starts shaking out the white pills.
Yeah, yeah, I mean, there's a lot of similarities. I would say, like, I wish we used more TMS in companion animals because at least it's a first tier drug. I think a
Yes.
lot of times we're using kinda higher tier drugs, maybe a riskier drugs in terms of AMR, when we don't need them in small animals. But yeah, it's an issue in human healthcare too. I think sometimes we just feel like we need to do something, and historically, we've thought that providing an antibiotic is less risky than not. And I think we really need to investigate kind of outcomes-based studies to see if that really holds up.
Yeah. On the flip side, you could think of a spectrum of care and like helping veterinarians not make clients feel guilty for not dishing out 100 or 200 or whatever they need for a 10-day course of antimicrobials.
Yeah, yeah, for sure. Antibiotics are not inexpensive,
Yeah,
especially those higher tier drugs.
sure. What sparked your interest in antimicrobial stewardship?
My interest really sparked because I saw a change just in my practice lifetime of, the when I first started practicing, antimicrobial resistant infections were really rare. It was almost like exciting when you saw it because it was so uncommon. And it got to the point where I was seeing these like weekly and, now it's daily, I would say. So that was alarming to me. Um, I work in a referral population setting, so I'm certainly seeing more than maybe in primary care settings, but I definitely saw a trend. So I felt compelled to like do something, figure out what's going on and do more. And kind of at that same time here in Minnesota, our Department of Health started a One Health antibiotic stewardship collaboration, which is a cross professional groups, including like pharmacists and physicians and dentists and veterinarians and food commodity groups too. And I learned a lot from that group about what was being done on the human healthcare side in terms of antimicrobial stewardship. So I think I really got excited that maybe those things were translational to us.
Fantastic. I love this, the idea of that group. Earlier, Sarah asked you what are some of the big take home messages, but whenever we do something like this, we're always surprised. What were some things that surprised you in this article?
Okay, so the biggest thing that surprised me was that the duration of prescriptions for antibiotics for treating infections, the median duration was like 10 days. So if you know you have an infection, you're treating for 10 days. But it was also 10 days for prophylactic treatment. So when we have no infection and we're just trying to prevent it, we're using antibiotics for the same duration, which I thought was wild. And clearly an area that needs some guidance because there's not a lot of prescribing guidance. Good news is that there's a group working on that. So I think we'll see some guidance within this next year, but that was really shocking to me.
You actually teed me up perfectly for my next question, which is what are the next steps for research in this topic?
Oh, so I mean, I think that, we're interested in looking at our own prescribing in our hospital, see if we can make some impacts there. I think studies like this provide some baseline data. So repeating studies, especially if there are new things that come out, like new guidance can tell us whether there's uptake of those things over time. But another area that we're focused on is new different methods for collecting this data. So we had a group of amazing volunteers at all the practices that participated in this study, and they manually, gathered data and put it into our online data capture system. And we couldn't have done this study without that, but it's a lot of work, and so it makes it hard to scale up. So what we're working on is gathering prescribing data directly from electronic health records at a large scale, so that there is really no effort on the practice level, and it's all work that we need to do. So that's what we're working on. right now.
Do you think AI could help with that at all?
Yeah, absolutely. What we found with working with electronic health records is that, there are things called standard fields where, there's a limited number of selections from a drop-down menu. They're not utilized a lot. We don't have like standard coding for diagnoses or for billing in vet med like they do in human healthcare. So most of that rich information that we're interested in is in what we call free text fields. So it's where you just type whatever you want. So in your soap notes, your doctor's notes. And there, we really need like AI to get that information out. And we've done some experimenting with that already. The one thing that we are, constantly thinking about when we use methodology like that is that we need to do it in a way that keeps data private. So that's what we're working on right now. And yeah, AI, I think we're going to see amazing impacts of AI, but I think we need to do it carefully.
And speaking of AI, just putting in a plug here, we have our AJVR Artificial Intelligence Supplemental issue coming out in March of this year. So very exciting for that. So be on the lookout.
Oh, cool.
Yeah.
I'm looking forward to that, Sarah. That's cool.
Yeah, no, it should be awesome. And for those of you just joining us, we're discussing how the measurement of antibiotic use in cats and dogs, presenting to you as primary care and referral practices, provides insights for antimicrobial stewardship with our guest, Jennifer.
Jennifer, how does your training and previous work prepare you to write this article?
Well, I think that's just as a group are really well trained in One Health. So I think for me, just my veterinary training made it pretty natural to look for methodology for data collection used on the human healthcare side and see how it could be adapted for vet med. Um, and then we've done a number of these what we call point prevalence surveys to collect this data. So we tried it out in our own teaching hospital. We did it every month for a year and got some really cool insights into what we were doing and how we could, change our practices. And then we expanded that next to practices in Minnesota, North Dakota, and then in academic teaching hospitals across the US. So this was the biggest study that we had done at that point. And but we had a lot of practice. We refined our methods. So that just makes perfect, I guess. Well, it makes better. I don't know what perfection really looks like yet.
I was literally just about to say that.
I'm from North Dakota, Jennifer. I don't hear too much Minnesota in your accent.
No. I was born in Philly. Yeah, but I'm a Midwesterner at heart, so I would never go back. I've been here, I think, longer than I ever lived on the East Coast.
Very good.
Midwest is best, I have to say. So Jennifer, this next set of questions is going to be really important for our listeners. We're going to try to boil all this great information that you shared with us today down to like one important point. So what is one piece of information the veterinarian should know about antimicrobial stewardship in small animal primary care and referral practices?
Yeah, so I think this idea of antimicrobial stewardship kind of feels like this big idea and maybe not something that is accessible. But honestly, improving prescribing, which is one of the goals of antimicrobial stewardship, can start with like one little action. So I think that's an important thing to remember. So picking a common condition, checking out prescribing guidelines and making one small change, like treating lower urinary tract infections for 3 days instead of 10, can make a really big impact. And once you have that under your belt, you can look to the next thing. But I think just taking small steps towards improving prescribing is the biggest take-home message.
So that's like my diet.
Speaking of UTIs, we actually had a really cool article published, a subsequent podcast episode where we interviewed the authors about in-house urine cultures to see like how feasible that was and how practical. So definitely some cool stuff with spectrum of care happening in the antimicrobial stewardship world. So on the other side of the relationship, what's one thing clients should know about this topic?
I think clients know antibiotics are life-saving, but what they need to know is that's only true if they still work. And I think we probably don't talk about some of these undesirable side effects. So I think clients, what I would encourage for clients is to advocate for using antibiotics, but only when they're needed.
Yeah, very well said. Thanks again, Jennifer. I learned a ton, and it's always good food for thought. I love your idea of starting small, just pick one thing, because you're right. It sounds very esoteric, academic to think about in the word stewardship. Yeah. So thank you for distilling it down for me and hopefully a lot of our listeners. As we close, we like to ask a fun fact. And for you, we'd like to know, what is Jennifer's favorite animal fact?
Well, I love octopuses or octopi. I'm not sure what the correct plural is, but they have 3 hearts. But what I didn't know is that they have 9 brains. They have a central brain and a brain for each arm. I think that is amazing. So that's my fun animal fact.
So I think what Lisa and I have learned, I can see Lisa laughing so she knows, is that the octopus fascinates veterinarians. I'm not kidding, Jennifer. I think almost everyone has answered this question with a fact about octopus. Their hearts are raised. Yeah.
But different facts.
Yeah.
The ophthalmologist answered about that they have a little perforation in their anterior chamber. Somebody else said the 3 hearts. You added 9 brains. Like, the octopus is fascinating.
Yeah, it really is. Like, I'm a sucker for those like nature documentaries that focus on octopuses. They're so cool.
Cephalopods are cool. Well, thank you again, Jennifer, for being here today, for sharing your manuscript with JAVMA, and just for sharing the information too with our listeners on our podcast.
Yeah, thanks a lot for having me. It was fun to share a little bit more about the study.
And to our listeners, you can read Jennifer's article in JAVMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.